Hello, everyone. My name is Mark Hagayama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient. Been dealing with cancer since late 2020, early 2021, doing very well here in Texas, and we are enjoying just such a beautiful time of year. The weather is very, very pleasant. It's in the 80s and not much wind. It's clear, so it's absolutely gorgeous. So wherever you are in the world, I hope that you are enjoying beautiful weather as well. And I am so thrilled and excited for this interview. And today, my special guest, her name is Helinka Carr, and she is from across the pond in the UK. And so, what I'd like to do without further ado, Helinka, please introduce yourself and tell us who you are.
Hi, I'm Helinka Carr. I am the owner of Unspoken Rosebud. I am a survivor and thriver from bowel cancer. Yes, it has left me with a ostomate stoma, but from that, I've been able to support and help more people who are living with this device that's stuck to a stomach. I didn't wholly go with the medical model in the UK that they wanted me to do because I am a Reiki master and a crystal healer, and I use those properties to get myself better as well as some of the conventional medication. So, quick roundup of me.
Beautiful, beautiful. Let's talk about how your journey with cancer started. I think that's a good place to start. So, if you could share with us, what led up to your diagnosis.
I occasionally had a bit of bellyache on my left hand side of my body, the odd bit of bleeding from the bum, and and they said you'd lose weight with cancer. I never did. I gained the damn thing. I always do the opposite from what it should do. But other than that, and occasionally I'd just be tired, but I don't know why I was tired. But I was working full time. I was running a house. I was, I had family and enjoying life. So I put it down to that. But my daughter noticed that I was grabbing my side a few times, and she just said, "Will you just go to the doctor?" So I made the phone call to the GP and said, "Right, I know I'm wasting your time, but hey ho, I've got pain in my side. I have occasional bloody stools. Other than that, I'm fine and dandy." So straight in for a round of blood tests. Following day, straight in to see the GP. And then she said, "You need a colostomy." Not a colostomy. Oh, can't think of the word now. Camera up the old posterior. And so I went and had that, but I had this lovely nurse, bless his cotton socks, a couple of years younger than me, and was laughing and joking about it all. He's going, "Oh, do you know what you're there for?" "Oh, yeah, colonoscopy." And he went, "Yeah, okay, do you know why you're having it?" I said, "Well, no, not really." I said, "But in for a penny, in for a pound." They asked if they wanted to sedate me, and I said, "No, I want to see what you're doing. I want to watch the camera, I want to see where it's going, and, all the ins and outs and all that kind of thing." And he says, "Well, you're of that age now, aren't you, love? You've got any orifice you've got, they're going to shove a camera in it, up it, and around it." So we were laughing and joking all the way through. And I went, "Well, you're not that far behind me, love. You know what I mean? So you get prepared." And then once we got into the room, we were still laughing and joking. He explained the procedure, and he said, "I'm going to take 3 to 6 samples of whatever we find, if we find anything. And then we'll, go from there." I went, "Yeah, yeah, fine. Job's a good one." And then as soon as, because the cancerous lump I had was quite close to the bottom of the rectum, the atmosphere in the room changed, but I didn't notice it because I didn't know what was healthy and what wasn't healthy in a bowel. Oh, I ain't got a bloody clue. So we did the procedure and whatever else, and then he got to the end and he's saying, "Right, I need to take some samples." I said, "Oh, yeah, yeah. You said 6, 3 to 6. And he went, "No, I didn't." I said, "You damn well did. You said 3 to 6 samples." And he went, "No, I need to take 12. And I went, "No, you said 6. You ain't having any more than 6. So you are on this table with a camera in the most nicest places." And he says, "No, you need to have 12. I will tell you later." And that's when I got the diagnosis then. But I'd gone to the appointment on my own. And I think, to be honest, that's one of the biggest mistakes I made. I should have been told by my GP, take somebody with you. You need to have somebody with you.
Would you mind explaining why? I know I've talked about it on previous interviews, but explain to our audience why that's so important.
Because then I had to go and tell my family what I had. And my husband wouldn't believe it. I'd phoned my son, and fortunately, he was working in the area. So I phoned him and I said, "Oh, what time are you home, love?" He says, 20 minutes. And he came immediately home, and I had to tell him. Now, if I'd been able to say to my husband and have it explained to him, he could have explained it to others and not put that pressure on me. That was hard. So anybody that thinks they've got any, just go take somebody with you. I mean, the nurse was brilliant. He said, if your husband wants to come in, I will sit with him. I will explain everything. I don't have a problem. But my husband just refused because he could avoid it. And whilst he hadn't been told by a professional that's what it was, it didn't exist, which didn't help me. So, yeah, I mean, I've said to my GPs and I've spoken to other trainee doctors and whatever else, I said, if you ever suspect not a great result, you make sure they take somebody with them, because you need somebody just to allow you to breathe and absorb it all in, rather than you having to regurgitate it out again and again and again and again, because you need that time to breathe yourself. So, yeah, take somebody with you.
Well, I think that is great, absolutely fantastic advice for another reason is the fact that if you go by yourself and you get that kind of a diagnosis, then a lot of times everything else goes out the window and you don't know what all is said. All you're focused on is the actual diagnosis and you're not listening to, the things that come afterwards. So it's very important. I agree that's a great thing to do. Of course, depending on the person, but to have somebody with you who could kind of corroborate what was said
Mm-hmm.
at that particular session. It is really, really important because of the fact that it's such a life-altering thing. All you're focused on is, hey, I've got cancer, and you're not listening, you know, at that point, you're not listening to the further things that are being laid out and said. Sometimes that's not the case, but in in the case of many people, that is the case.
Well, like I say, it was a nurse that told me this, so he didn't know what would or wouldn't happen. He just knew that I had this mass inside of me, and he knew straight away what it was. He says, "I'm really, really sorry to tell you." I said, "I don't even need it to be, checked out. That is cancer." But like you're saying, to go to any other appointments, but it would have been just great for somebody else to be there just to say that's what they've said, rather than. I mean, obviously my husband knew it was happening, because then it was just bang, 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 appointment after appointment after appointment after appointment. It's serious then, before you see the consultant who says, "Oh yeah, it is this. It's at this level, and this is what we're going to do." It's But yeah, like you're saying, any not necessarily horrific, but life changing or life altering, you must. I'm sorry, it is a must have somebody with you. And it's just necessary just to hold your hand, even if they don't take anything in, because they could have that total mind block of hearing certain words and just go shut. But they'll say, yes, that's what they said. After that, I couldn't tell you what they said, but that's what they said.
Yes, I agree. Absolutely agree. It is such a life-changing, life-altering potential anyway, life-altering event in a person's life. And I don't think that, from the doctor's standpoint, that they're really looking at that aspect. That here this person is coming into your office and I am going to change that person's life. I don't think they're thinking in those terms, but that's exactly what's happening, right?
Absolutely. And like I've said, we used to have a consultant, a bowel consultant used to come into our support group. And he was a lovely man, you know what I mean? He would answer any questions and he was brilliant. And then at one of the meetings, he'd said, oh, when we give you your diagnosis, it doesn't affect anybody else. And we was absolutely stunned to silence. You know what I mean? And it was like, it affects everybody around us. Every single person that is around us is affected by this diagnosis. You know, it's like, and you know what I mean? He just says, well, never ever gave a thought that it affected more than the person that was sat in front of me. And I thought, you must have seen people that have come in with the patients devastated or shell shocked or just, you know, just not there. You know, it absolutely flummoxed us all. We just couldn't believe this is what he was saying. But it's obviously common that that's how they think. But
Hmm.
then when I spoke to my consultant, he did say to me, we don't see you as people, we see you as a diagnosis, because if I saw you as a person, I couldn't do my job.
Wow.
And I just thought, right, okay,
Really? I have never heard that.
yes,
Oh my goodness. Wow.
yep.
I mean that's basically telling the person that they're just a number. And wow, that is I'm shocked that somebody told you that.
Well, yeah, as you can see, he wasn't trained in the UK. He was trained in Switzerland. So whether they have a different approach from what we do in the UK, I don't know. But I think a lot of it is we built that rapport up with each other. And like you know, he'd phone me up and say, right, okay, I've got half an hour. I know it's not an appointment, but come and speak to me. Let's have a talk. Let's go through what we're going to do. And he did that 3 or 4 times to me. So we built up a relationship outside of his appointments. So that was maybe where I got a more honest answer out of him. But then if you look at what the Mr. Burke had said, then you're thinking they don't see the whole picture, do they?
You know what's fascinating to me, and I appreciate, your input. Different countries around the world have different medical systems and they treat, different diseases differently, including cancer. And I really appreciate this perspective from, your part of the world, and how your side deals with cancer, which is it's similar, but it's different than the way it's done here in the United States.
How is it different then? How do you feel it's different?
It just, from what you're telling me, it's just uh, there are slight differences, a lot of similarities, but
Mm-hmm.
there are differences, and the philosophies I think are slightly different because your medical system is um, uh, ours is mostly private, uh, and people are responsible, and people get their medical coverage through their companies that they work for and things of that nature. Whereas in the UK, you have state-sponsored medical care, right?
Yes, we do. We do.
Which is very, very different than what we have here. So these differences around the world can make a difference, depending on the particular situation. So it's great to hear a different perspective. So once you got your diagnosis, what what were you thinking about moving forward? How were you going to deal with that moving forward?
First and foremost was getting people around my family, making sure that they had support. So I know, because I worked in health and social care, which is, you know, when you work with vulnerable people and helping them with the situations that they're in. I knew that the NHS wouldn't support my family because they just concentrate on the patient and that's all they concentrate on, which is fair enough. They haven't got the means or the money to do the whole family. So I knew I had to get them support in. So I made the phone calls to people. I made went and spoke to the neighbours and said, if you know what I mean, if you see them, just talk to them, just be there for them. That was my first primary worry and concern, and that's my first action, was to make sure the family had their support, because I knew the NHS would do what they did to me. So that was my primary. And then obviously thinking, you ain't getting me. No matter how bad this cancer is, you are not getting me. No matter what, you might move somewhere else, but you are not getting me. And that was my second thought.
That brings up a great point. Is your mindset of your resolve to your mindset, and your mindset is, I'm going to beat this thing,
Mm.
and so I want to stress how important that is for anybody going through cancer, is to be able to believe that you're going to beat it. If you don't have hope as any kind of patient, how are you going to get better? If you buy into every word that your doctor or oncologist says, uh, for instance, my oncologist told me, your cancer is so bad, stage 4 prostate, bone, and lung cancer, I can't cure you. So I was like, okay, I appreciate that. I appreciate all the testing. But what you're telling me is I have got to find a way myself, which I've done. And so that is, your mindset is so important. So talk about that and how you used your mindset in your cancer journey.
Well, it wasn't just my mindset that I did use. Obviously, being a Reiki master, I used Reiki. I'd scan my body and find out where.
Were you a Reiki master before?
Yeah,
You,
I
you
was.
were. Oh, okay.
Reiki master before and a crystal healer before. And like you say, I just scanned my body and it was like, right, okay, then. See, this is something else that people don't realise, but they're starting to cotton onto it now. Your immune system, that is one of the most powerful tools, as well as your mind, to beat cancer, to beat invasive diseases. Because then because like I say, there's a lot of research, isn't there, about immune concentrated treatments. And once I woke my immune system up and said, right, in this area, there's a problem. There's a problem that we didn't know. So there was no blaming, no shaming, no thinking. But we have to deal with this. We have to stop this from moving, spreading, growing, whichever. And then what I did was, because then after all the scans, as you know yourself, the scans and the MRI scans and CAT scans and everything else, you're absolutely exhausted. So you spend a lot of time in bed. So I put crystals around my bed so that when I was in bed, they were working with me as well as as my immune system, and as well as the Reiki. And I just combined them together. And once it all started clicking together and working together, I shrunk that down within 6 weeks to 45%. The tumor would been the surgeon couldn't believe it. He said, I expected to cut you from your breastbone all the way down to your tummy. He says, and I haven't had to cut anything like that from you because you'd shrunk it that much.
Wow. That is phenomenal. Absolutely phenomenal. I think your mindset was just absolutely fantastic. And it's the way that people should apply it, but they don't. Most people just don't know how. Most people don't realize the importance of the mind. When I was going through, when I first started going through cancer, I had to assess my personal attributes. And so I looked at my body, and I realized, in fact, we were talking about it before, and you saw the way I looked.
Mm.
My body was worthless. I mean, I was down to 123 pounds. I was weak as weak could be. But what was not weak was my mind. My mind was actually as strong as it ever was. And so I set out daily to learn and to grow and to harness my mind as part of my cancer journey. And I think that's something that is so totally underutilized is the power of the mind and how important the mind can be as a healing tool.
And like we said, your immune system. Once your immune system realizes it's got a foreign body in there, it will go and attack. So, like you're saying, it's waking up your head and realizing you have choices. You you need to question and take a breath and look at what else is there. Complementary. That's why it's called complement. It complements what the medical model does. But you don't have to just have the medical model. You often have the answers for your healthcare more than anybody else does. You know what your body can take. You know how much you physically, mentally, and emotionally can take. Other people don't. So you need to sort of look into yourself and go, how and why and when.
Beautiful, absolutely beautiful. We have more power up here than we even realize.
Mm.
I mean, our minds are so totally underutilized, and it is a very, very important tool in any health journey. And and it's critical. And so why not use it? Because that's what you've been blessed with. You've been blessed with a mind, and if one aspect of your being is compromised, use your mind. Your mind is totally powerful. What I want to ask you right now is, I'd really, we haven't even scratched the surface of of where we want to go. Would you be willing to come back and shoot a part two to this interview?
Absolutely. Like I said, the more people we empower to give choices, and the more people that we can say, take a deep breath, take the information in, and make a choice. You might still agree to go with the medical model, but you might also say, well, I'm going to try this as well, and I'm going to look at that as well. And that's the most important thing, is giving people the confidence and the ability to make an informed choice.
Very well said. I'm going to ask you a couple questions uh, before we uh, close off this part one of our interview. What would you like to leave based on what we've discussed so far? What would you like to leave our audience as the most important point?
Right, this is going to contradict something you've said a couple of times, but do not say my cancer. Say the cancer. As soon as you own it, it owns you. And I know it's only a little play on words, but this powerful thing up here hears those little play on words. So yes, you have cancer, but it doesn't own you. You own it. You decide and you dictate how it's going to be responding to what you're going to do to it. Whether you, like you say, whether you stick with the medical model and use all of that, or whether you question the medical model and go, I'll have a bit of that and a bit of that, but I'm not having that. Or whether you go for complementary therapy and use your brains, use that subconscious mind. It's amazing. Absolutely so underestimated. And yet there's no point in sugarcoating it, because it's a hard journey. It's a bloody hard journey, no matter what. But you do not have to take everything that everybody says as gospel. Look things up for yourself, but don't go down the rabbit holes, because there's so many conspiracy theories out there and such other else. Listen to what your body and your brain is saying. If it's saying, no, I don't like Reiki, well, then don't look it up. No, I can't understand how crystals are going to help me, even though on a molecular, I can't even say it, molecular level, there's a lot of evidence on how they can help you. But if it's not right, but don't just take what the doctor says as absolute total gospel. Think for yourself.
Great advice. In fact, you brought up something that nobody's ever brought up to me before. And I had people early on telling me that I shouldn't embrace my cancer journey the way I do.
Hmm.
It's different for me because of the fact that I have, you know, two YouTube channels, a Rumble channel, cancer group, and everything like that. So early on, I decided to just own it. You know, hey, that's part of my journey and everything like that. So, but it's great advice for, you know, the average person who's just dealing with cancer on their own. Uh, that's absolutely fantastic advice, and I do agree with it. I went through that struggle early on, and I just said, well, because of the fact that I'm, you know, going to be everywhere or out there, I'm just going to own it, and that was my approach. But that's a great point, really, really great point. So I appreciate you doing that.
Yeah, but there's one little tweak you've said differently now than what you've said before. You said cancer journey. Before, you said cancer. Now,
Uh,
owning your cancer journey, that's a totally different thing from
mhm.
owning the cancer. You know, it's just little tweaks on the little bit of wordplay. But yeah, like you're saying, you should own your journey because it is your journey. You've made decisions, and you've, like you say, you've stood up to what was recommended and what was, like say, your oncologist used to just look at you and go have steam pouring out of her ears, going, "What's he doing to me now?" kind of thing. And that is the right way to have. Own the journey, but not the disease. That's
Right.
the difference.
Absolutely. Final question for you for today. If you had a superpower
Right.
and you could do anything within your capability, how would you make the world a better place for everyone?
I don't think you can make the world a better place for everyone, but for the people that we're working with, it's giving them the confidence and the ability to take a big, deep breath and look at the whole picture and to think for themselves, to give them the confidence to actually think for themselves that little bit. I mean, like we said before, you know, you go into an oncology waiting room and you can see these people just pacing up and down and thinking, giving somebody else they don't know the total and absolute control of their life, their journey. And it's like, hell no, this is your life, this is your journey. You decide and you make informed decisions and have the confidence in yourself because you are bloody amazing. We are all amazing.
Absolutely. Absolutely. Helinka, it's been an honor and a pleasure. And I appreciate you sharing your knowledge. And we're going to hear more from you in the next part, which I'm looking forward to doing. I'd like to thank each and every one of you out there for joining us here at the Be Your Own Hero. Please like, subscribe, make a comment in the comment section of the video. Most importantly, we're human. We only go around once. And so let's make the most out of the time that we have here. The most precious thing that we have on this earth is not money, it's not things that we accumulate, it's time. So make the most out of the time that you have and help as many people as you can. And let's help make the world a better place for everyone. Do, even if it's small things, you know, make an effort to do things for other people and make the absolute most out of each and every day, each and every hour, each and every minute, and each and every second. Thank you so much for joining us here at To Be Your Own Hero. We will see you next week for part two with Helinka Carr on To Be Your Own Hero. Thank you very much.